Biceps tendinitis is a condition that causes pain, discomfort, and limited mobility in the front part of the shoulder and the upper arm due to inflammation of the biceps tendon. The biceps muscle is an essential part of arm function, responsible for elbow flexion, forearm supination, and contributing to shoulder stability. The long head of the biceps tendon passes through the shoulder joint and into the bicipital groove of the humerus when subjected to repetitive stress, excessive load, or degenerative changes. The tendon can become irritated, inflamed, and painful, limiting movement and function. The causes of biceps tendinitis are multifactorial. One of the most common reasons is repetitive overhead motions that place excessive strain on the tendon, often seen in sports such as swimming, baseball, tennis, and weightlifting. Occupational tasks that involve lifting, pulling, or working above shoulder level for extended periods can also contribute to the development of this condition. Over time, excessive mechanical stress results in microtears, weakening the structure of the tendon and making it more susceptible to inflammation. Age-related degeneration is another contributing factor. As people age, the tendons lose elasticity, making them more prone to injury. Poor posture, muscle imbalances, and shoulder instability further increase the risk of biceps tendinitis. Genetic predisposition may also play a role in tendon susceptibility, with some individuals having inherently weaker connective tissues, predisposing them to tendinopathies. Pain is the most common symptom of biceps tendinitis. It typically presents as a deep, aching pain in the front of the shoulder, which can extend down into the upper arm. The pain often worsens with overhead activities, lifting, reaching, or sudden movements. Many individuals report tenderness over the bicipital groove. When pressure is applied, some may experience a snapping or catching sensation with shoulder movement. In chronic cases, muscle weakness and reduced function can interfere with daily tasks such as reaching overhead, lifting objects, or even simple movements like getting dressed. If left untreated, biceps tendinitis can progress to more serious conditions, such as partial or complete tendon tears, requiring more aggressive intervention. Diagnosis of biceps tendinitis involves a comprehensive medical history, physical examination, and diagnostic imaging. During a physical examination, the doctor assesses tenderness along the biceps tendon and evaluates range of motion, strength, and stability. Specific orthopedic tests, such as Speed's test and Yergason's test, can help pinpoint the affected tendon. In some cases, additional imaging studies such as ultrasound or MRI may be required to assess the severity of the condition and rule out other shoulder pathologies, including rotator cuff tears, labral injuries, or osteoarthritis. X-rays, although not useful for evaluating soft tissue inflammation, can help rule out associated structural abnormalities such as bone spurs or calcifications. Treatment for biceps tendinitis typically begins with conservative management aimed at reducing inflammation, relieving pain, and restoring function. Rest and activity modification are key components in managing symptoms, especially in the acute phase. Avoiding repetitive overhead movements and heavy lifting helps prevent further irritation of the tendon. Ice application for 15 to 20 minutes several times a day can help reduce swelling and discomfort. Over-the-counter non-steroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen or naproxen, may also be used for symptom relief. Some individuals benefit from using a shoulder brace or support to limit excessive movement and allow the tendon to heal. Physical therapy is one of the most effective treatments for biceps tendinitis. A well-structured rehabilitation program focuses on correcting muscle imbalances, strengthening the rotator cuff and scapular stabilizers, and improving shoulder mechanics. Stretching exercises help restore flexibility, while eccentric loading exercises promote tendon healing. A gradual return to strengthening and functional movements is necessary to prevent re-injury. Advanced therapeutic techniques such as ultrasound therapy, electrical stimulation, and soft tissue mobilization may further aid in pain relief and tissue recovery. Home exercise programs are an essential component of rehabilitation, ensuring continued improvement and long-term shoulder health. For individuals who do not respond to conservative treatments, more advanced interventions may be considered. Corticosteroid injections into the bicipital
groove can provide temporary pain relief by reducing inflammation,
although frequent use is discouraged due to potential tendon weakening. Platelet-rich plasma (PRP) injections, which contain concentrated growth factors derived from the patient's blood,
have shown promise in promoting tendon healing.
In cases where conservative measures fail, surgical intervention may be necessary. Biceps tenodesis and tenotomy are two common surgical procedures, performed to relieve symptoms and restore function. A biceps tenodesis involves retouching the tendon to the humerus to relieve tension and maintain strength, whereas a tenotomy involves releasing the tendon completely, which may result in a cosmetic deformity known as a Popeye sign.
Preventing biceps tendinitis requires a proactive approach.
Proper warm-up routines and stretching before physical activities can help maintain tendon flexibility. Strengthening the rotator cuff and scapular stabilizers improves shoulder stability and reduces strain on the biceps tendon. Maintaining good posture, particularly while working at a desk or lifting objects, minimizes excessive stress on the shoulders. Gradually increasing exercise intensity and avoiding sudden overloads can further prevent injuries. Workplace ergonomics should also be optimized to avoid excessive overhead, reaching, and repetitive strain. Recovery from biceps tendinitis varies depending on the severity of the condition and the individual's adherence to treatment. Most patients experience significant improvement within a few weeks to a few months with conservative care. Commitment to physical therapy, activity, modifications, and a structured rehabilitation program enhances long-term outcomes. Those who require surgical treatment may need a longer rehabilitation period, including post-surgical physical therapy and gradual return to activities. Postoperative rehabilitation typically involves passive and active range-of-motion exercises, followed by progressive strengthening to ensure optimal function. Biceps tendinitis, while a common and potentially debilitating condition, is highly treatable with proper management. Understanding its causes, recognizing symptoms early, and seeking timely medical intervention are essential in preventing complications and ensuring successful recovery. A structured treatment plan that includes a combination of rest, rehabilitation, and, if necessary, advanced medical interventions can help individuals return to their normal activities without pain. Additionally, prioritizing long-term musculoskeletal health through lifestyle modifications, regular strength training, and proper biomechanics can help prevent recurrence. Raising awareness about tendon health and injury prevention strategies can further contribute to reducing the prevalence of biceps tendinitis. ensuring better health outcomes for individuals of all activity levels. Further research and technological advancements in regenerative medicine may continue to improve the management and treatment outcomes of biceps tendinitis, leading to even more effective solutions for those suffering from this condition.